Assalamu alaikum. Our today's topic is to discuss about the morphology of Graves' disease. But before starting its morphology, let me give you people a brief review about Graves' disease. It is actually the most common cause of endogenous hyperthyroidism, and it is an autoimmune disorder. Okay, in its pathogenesis, there are many antibodies which are included, like thyroid stimulating immunoglobulins, thyroid growth stimulating immunoglobulins, anti-acid binding inhibitor immunoglobulins, etc. But as we are not concerned with its pathogenesis, we are mainly concerned with its morphology. So let us start with its morphology. Here are again three features, microscopic features that you must remember in order to identify a slide of Graves' disease. Its first feature is that mm, almost all the features are shown in this slide, but let me tell you that its first feature is that here the follicles are present. See, you can easily see here a follicle. Okay, but here the follicular cells are so much crowded that they form a pseudopapilla. Okay, like you can here see that it is papillary formation. Follicular cells are actually so much crowded that they form papilla, and these papilla project inside the lumen of this follicle. Okay, we call this as pseudopapilla because it doesn't have any fibrovascular core, but carcinomas have fibrovascular core, as carcinomas are or tumors, either it is benign or malignant tumor, they need blood supply, so they have to maintain their vascular supply. So inside their papillas there is fibrovascular core, but in the case of Graves disease these are pseudopapilla as well as there. Why they are called pseudopapilla? Actually they are called pseudopapilla because there is no true fibrovascular core, okay, which must be present in a true papilla. Okay, number two feature is that, as I said before, that there is crowding of the follicles. Follicular cells are dividing very actively in this case, and they are very active metabolically as well. So what they do absorption of the colloid. As a result, there is scalloping of colloid. Okay, scalloping of colloid. Here you can see. You know what is scalloping? Just like this. Okay, here you can easily appreciate that there is scalloping of the colloid, right? Okay, so number third feature is that follicular cells here are tall and columnar. If you can see, let me zoom it. You can see here that here the cells are somewhat tall or somewhat columnar. Maybe here you cannot identify. I will show it to you in the later slide. Okay. So again, another slide, you can see that there is scalloping of the colloid as well as it is a follicle, but in this follicle the true papilla are projecting in its lumen, and which results in the scalloping of the colloid as well, scalloping of the colloid, scalloping of the colloid here. Here I must zoom. Maybe you can appreciate here that here cells are somewhat tall or columnar. As you must know a normal follicular structure, I have explained it before in my previous video, but let me revise it again. Let's suppose this is a follicle. Here the cells are, we can say that flat cells are present, but in the case of Graves disease, these cells are somewhat tall and columnar like cells. Okay, here maybe you can appreciate it. Okay, so again here the pseudopapilla, this is a follicle. Here the pseudopapilla are present again. Okay, so here you can also see scalloping, and here you can also see scalloping of the colloid, right? Here, and here you can see that in Graves disease, it is actually a histological diagram, but you can see here that there is scant colloid, or we can also say that scalloping of the colloid also occur here. There are follicles with tall columnar epithelium, okay, and there are scattered lymphocytes as well. Lymphoid infiltrates consisting predominantly of T cells with fewer B cells are present throughout the interstitium, okay. In Hashimoto's disease, we are not concerned with Hashimoto's disease right now. We will discuss it later. Okay, so again, I am zooming it. Maybe you people will be confused, and maybe you confuse it with the medullary thyroid carcinoma. But you can see here that here somewhat papillary structures are present, which are not present in medulla. Why I'm saying that you people will confuse with it with the Graves' disease, this particular diagram with medullary carcinoma, because I do the same. But why I do the same? Because here is somewhat light pink colored structure, which I may think or might be used to think that it is maybe a myeloid structure, which is a characteristic feature of the medullary carcinoma. But remember that if you see it clearly, then it has scalloped margins, okay, which are not present in medullary carcinoma, right? And moreover, here structures are arranged in the form of, here follicular cells are arranged in the form of papilla, okay, which are not present in medullary thyroid carcinoma, right? Again, in gross, on these all were microscopic features of thyroid disease. Now let us discuss about its gross morphology. Soft, meaty appearance of thyroid tissue occurs just like a muscle, and it is diffusely enlarged. Thyroid gland as hyperplasia and hypertrophy both occurs in this case. Okay, so it is diffusely enlarged, and there is no nodules, or you can say that there is no uh, enlargement of thyroid gland in any single area, but it is diffusely enlarged, right? Again, another structure. Okay, so some extrathyroidal manifestations of Graves' disease are also present, which includes dermopathy and ophthalmopathy, as Graves' disease is a triad of ophthalmopathy, dermopathy, and thyrotoxicosis. Okay, so I have explained you the morphology of the Graves' disease, and moreover, one more thing that I want to add here is that in the case of Graves' disease, there are episodes of hypothyroidism as well as hyperthyroidism. It is many times asked in your exam that why it occurs so. That then your answer is that it occurs because two types of antibodies are involved in its pathogenesis. One is thyroid stimulating immunoglobulin and thyroid growth stimulating immunoglobulin, and on the other hand, there is TSH binding inhibitor immunoglobulins. As there are two types of antibodies, stimulating as well as inhibitor immunoglobulins, that is why two types of peaks or streaks occur in its manifestations like hyperthyroidism and hypothyroidism. Okay, so this is your answer that you have to give. I'm not going in its detail because we were concerned with its morphology mainly. Thank you very much.